I'm
Okay,
sorry, people, because this is very good, and this should be distributed all over the place.
thank you. Okay, so we take out the cost of the care and the cost of medication because now you're competing and there's only one payer. And now the jar is not completely empty. We're not talking about free care, right? But we're talking about a jar that is going to have half of the cost and or slightly above half of the cost of what we are paying now for a system that continues to kill people, particularly the poor, particularly the people that are dependent of other individuals, and it kills with more severity women and people of color. So it's a system that it's designed to be misogynistic, and it's a system that it's designed to be racist. And so that's the system that we have right now. And tonight we're going to be talking about how we can help another way of having healthcare that is more humane, that is more inclusive, and that is going to take care of everyone. And all of the speakers tonight, and I think everyone in this room understand the importance of that. And we're going to now jump on the remaining of the conversation. How are we doing with time, Glenda? Okay,
You're
let me
doing
just jump.
good. No, you're
I'm
doing
sorry.
good. You're doing good.
Okay, thanks. Um, okay, I'm going to tell you something a little bit more personal now. So I'm going to take my hat of the moderator and the hat of the welcoming, but I'm going to tell you why is this very important to me. Okay, so this is in 2022. I was a physician working in the border of Mexico, and I worked in a tiny clinic. I took care of a lot of patients, and many of those patients were American citizens. And I really didn't understand what was going on, why my waiting room was so full of people that were just traveling. And I thought that it was just that they were traveling, they got sick, and they came to see me. But a lot of the times that started happening more and more frequently, and I started having regular travelers. Okay, so that started spiking a little bit my curiosity, but still I didn't understand too much about the healthcare system in America. So I was not going to emit my judgment. I just knew that I had a lot of American patients. That's it, right? And a lot of them were there for the insulin. A lot of them were there for medications for, when you have hypertension to lower your blood pressure, like chronic diseases. And they would come to get their medication there because it was a lot cheaper, right? And these, these were not then just tourists. They were medical tourists, as some people describe them, right? Then suddenly, this became even more personal to me. So in 2003, I got an autoimmune disease and I became completely paralyzed. I'm talking about in a matter of a couple of days. I started first having some difficulty raising my arms, and then I started having some difficulty breathing. And then the next day, I had my face completely paralyzed. I couldn't close my eyes to go to sleep. I couldn't swallow. I couldn't talk. I couldn't do anything because everything that I'm describing, including your breathing, is not because your lungs are expanding. You breathe because of the action of your muscles that create the negative pressure in your thorax so that your lungs expand. So a lot of the vital functions were shut down in a matter of 2 days, and I had to be taken into the ICU, and it was a very scary situation. I am lucky that the the Mexican healthcare system at least has this honor system where, because I was a physician, I was taken to the ICU without having to immediately start paying or anything like that. But my family, who were living already in the US, started traveling and paying for my care, and even with the help of the hospital, who were not charging me for the stay. They were not charging me for medical honoraries, because the doctors also were, like, in consideration of me being a physician, they were not charging all of that, but only because of the cost of medication. And we're talking about in Mexico, medication is cheaper. Well, it was overwhelming. And I knew that my recovery was not going to be immediate. The disease was taking my mobility very suddenly, but my recovery was not immediate. It took 2 years for me to be able to walk correctly. So I knew that I was not going to be doing that recovery in Mexico alone. So I traveled with my family to the US. And here is when things got really scary, right? Because I now was part of a system where everything needed to be paid up front because I didn't have insurance, right? And at least I was lucky that I was a physician, and that my doctor that was taking care of my physical therapy understood that I knew what I knew, and he explained how to do the therapy for myself. And with the help of my family and my knowledge, I was able to recover. But I know that if I didn't have those things, which sadly a lot of people don't have, I would not be here. I would have been dead. So I know that it's a bleak story, but it's time. And I think that it's a good start for our conversation tonight. So moving on, we're going to go now to sorry. I'm sorry. Lost my next one. Okay. So we're going to move on now to Stefan Ramdor. And Stefan is the president of the Medicare for All Florida. And we welcome you. And please share with us a little bit more about your organization and yourself.
Sure. Yes, hello everyone. This is wonderful to be with all of you tonight. Lorenzo, thank you so much for the invitation. So, my name is Stefan Ramdor, pronounce him. I live up here in Coral Springs, and my day job currently is that I'm field representative for the Florida AFL-CIO, and yeah, in my free time, I'm volunteering to be part of the Medicare for All Florida nonprofit organization. So my backstory is basically that I'm originally from Germany. That's where I spent the first 37 years of my life. And at the same time, it was such an interesting experience, 2015, when I did come to the United States. So first to Connecticut, how, yeah, these things that I took for granted, say like that working people can still have like a dignified life, um, that those really kind of didn't exist here. So, for example, my first job was just like an entry-level job, where I made minimum wage, and I kind of like realized, oh wow, this is not enough to, get an apartment. Or there's another thing was like healthcare to, have it that like a quarter of my income goes to the health insurance premium, but then I'm still not able to receive all the healthcare I need because the co-pays and deductibles are so high. And so that's kind of like really what on the one hand, kind of made me try to get more involved in the union movement. So I kind of like specifically sought out a job where I was going to be with a union member at AT&T when I worked for AT&T in retail, and I became yeah, eventually departmental vice president for CWA. Once I moved down to Florida here in Orlando, the CWA Local 3108, just because I noticed how, yeah, it does make such a big difference for working class people to have a job where actually there is a union, and the wages and working conditions are so much better. At the same time, yeah, I also just wanted to kind of take action on healthcare, and just coming from this experience where I do know that universal healthcare can be possible because I was able to live it being back in Germany. So Germany basically has a public healthcare system where 90+% of the population is part of this public health insurance, where you just go to any primary care physician, to any specialist, have any diagnostics done, and there's no charge. So basically, you show your public health insurance card, but you don't have any checkout when you leave the doctor's office. You don't get like a bill afterwards in the mail, and basically, there's peace of mind when it comes to healthcare. And I have that experience that it is possible to have something like that, and at the same time, then coming here to the United States and seeing how both for my wife and myself, we weren't really able to receive all the healthcare we needed, as well as so many others, of course, that like family, friends, and others that we're in contact with. So yeah, that made me want to try to organize on the issue of healthcare. So as I came down here to Florida, for example, I helped try to bring together like lots of folks who cared about this issue, and we started Medicare for All Florida, which we were able to, I feel like, get some things done when it comes to trying to move the needle, like in the state of Florida for universal healthcare. Like, I'm just going to mention one thing. For example, last November, we, together with Healthcare Now, put on like a huge event, an in-person universal healthcare conference up in Rockledge, which I kind of really felt like helped to showcase all the work that we're doing. Um, and then, well, it like kind of just inspired people to be active on the issue of healthcare. So thank you so much for having me. Looking forward to the program tonight.
That's awesome. Thank you, Stefan. And Terry, you're up.
Okay, good evening, everyone. My name is Terry Falbo, and I'm on the board of Medicare for All Florida, and I've been a healthcare activist for a very long time, too long. We should have had universal healthcare by now, but we still don't. So I still have to work on it. One of the things I wanted to do tonight was just kind of explain the difference between Medicare and Medicaid, and then the difference between what Medicare for All, how it would kind of, in a sense, combine the two and be better. Because I think we've had even some people, some legislators who have signed on to our Medicare for All, to our petition or whatever, signed on to the bill, co-sponsoring it even, or saying that they support it. And then they'll say something like Medicaid for All or something like that. So it's kind of like maybe they don't quite understand it. But right now, the way that it is, Medicare in this country is mainly for people 65 and older, or people with disabilities who are younger. And it used to be almost all just through the Medicare system, but more and more it's been privatized, in the sense of a lot of different what they call advantage plans and everything, where private insurance companies get involved, and then they limit, they have networks, they promise you all kinds of good things, and many times it is good, at least for a while, until something unusual happens that you didn't have when you first applied for it, and then you may have a hard time seeing the proper specialists that you need, or getting the type of therapies that you need, etc. Medicaid is more, even though it's partially funded by the federal government, and there are some regulations from the federal government, but it's also gets some funding from the state government, and it really varies very greatly state to state. And it's large, so it's managed by the states. And then it's, at least in Florida, I'm not sure about other states, but in Florida, it is extremely privatized, the different companies that run Medicaid. And it's mostly for low income people, and for seniors. But even with seniors, you have to either prove that you have you have to spend down assets, unless, sometimes there are some wealthy people that figure out ahead of time how to kind of game the system and put things in a trust or something like that, and like where they don't have that much money that's available, and so they're able to qualify that way. But most people have to spend down assets in order to qualify for it. But it does, in one sense, it does cover a lot of things that Medicare doesn't cover.
Thank you, Terry.
So it are you saying thank you for what I said, or is it time?
Thank you, because it's time. Yes.
Oh, okay. Okay, sorry. Okay.
We are going to have the opportunity of completing some of those ideas as we move forward, because there's going to be some questions later, and the answers can be embedded in that. But thank you. Oliver, your turn.
Yeah, thanks, Carolina. Thanks, Lorenzo, and everyone with Labor Community Alliance for organizing this forum. My name's Oliver Larkin. I've been involved in the fight for Medicare for All for over a decade, and I trace this back as a progressive activist and campaign staffer and union organizer to my experience getting a higher education at a time when my family began experiencing multiple concurrent healthcare crises that really upended what we had planned for. And as I was taking out much more student loan debt, as my mother was suffering from an autoimmune illness that she contracted from a tainted cortisone injection from a pharmaceutical lab, and my sister was dealing with mental health and addiction crises. I heard a candidate for president, Bernie Sanders, talking about Medicare for all. And it just so immediately connected for me, um, the injustice and the precarity, really, that this system, this American healthcare system brings, where one illness, one accident, one disease can completely upend a family's finances and put you deeply into debt and just cause all of these compounding issues that can really uh, snowball, and that struck me as a terrible injustice. And so working on campaigns and with nonprofit organizations like Our Revolution that came out of the Bernie 2016 campaign. I've been someone who has worked to drive calls to members of Congress or to the California State Assembly or to different assemblies across the country, advancing their own Medicare for All legislation, uh, educating people and empowering grassroots groups to know the facts, which is that the United States is the highest income nation on earth not to guarantee healthcare as a right. And in fact, we spend more than twice as much per capita as most other developed nations for our healthcare. And this is just an incredibly ineffective system that brings so much misery and pain, and this shared human experience of having health. It's just fundamental. We saw this during COVID-19, that we rely on one another's health for our own health and for our own safety. So I've really come at this from a grassroots organizing perspective. And I think it's important to center community stories and to tell personal story when it comes to this, because ultimately we all come at this from different perspectives and different areas of expertise. But ultimately, healthcare is a human right, and it is something that we should all concern ourselves with. So, again, very pleased to be here and looking forward to the conversation tonight.
Thank you, Oliver. And yes, it's something that humanizes us, right? From the moment of birth to the moment that we die, we have healthcare events, right? We're going to move on to the next section of our forum, and this is a little bit more relaxed because we are only going to address 4 main questions, and each one of you is going to have still the 3 minutes to answer. But please, when we get to the final, if you're just closing with an idea, just extend it so that you can finish the idea, but don't overextend it, please, so that we can allow others to speak. Okay, the first question is about healthcare as a human right. Okay, Oliver was just talking about it. The question is, why is healthcare a human right, and who is harmed when it's treated as a commodity? So feel free to jump in, or if you have anything pressing, just do that, or if not, we can start appointing speakers out of our speaking panel. Anybody wants to take that one? Okay, Stefan, you're up. Why is it a human right?
So, yeah, I was gonna take the second question, remember?
Yes. Okay, I can do the first one then. Why is it a human right? Because all of us require it so that we can live, so that we can love, so that we can be fruitful in our lives. That means that we can touch each other's lives, that we can produce, so that we can have a healthy nation, that we can have a healthy planet. We need to be healthy so that we can create health as well, right? And if we don't have it, if it starts being treated as a commodity, that's when we see the differences between Europe or the big nations with this big nation that is acting more like a banana republic, right? And so we have a lot of people that are unhealthy, that are not doing any preventive care, that are having diseases that could have been preventable, and complications of diseases that should not get that far because they are not having care. So we are an unhealthy nation that keeps poverty as the modus vivendi, as the way that we live, and that healthcare becomes a bargaining coin so that women do not leave an abusive marriage sometimes. Children are trapped because of healthcare. That's sick, right? People are tied to an employment that they don't want to be in because of the healthcare, right? So as a nation, it prevents us from growing. And I think that it's not just the smartest move, it's the most humane move. And that's why I think healthcare is a human right. Okay, next question. So this one is for Stefan then. Okay. In clear, plain language, how does single payer work? And what changes from patients, workers, and providers?
Carolina, of course, I can try to chime in on that. Was it possible for me to share my screen? Do I need to be made a co-host for that?
Okay, I'm gonna reclaim the host, and I'm then gonna make Stefan the co-host. I mean the host, because I don't have co-host feature here.
Thank you.
Okay, make Stefan the host. Oh no, I changed back again to. Okay, there you have it, Stefan.
Oh, great. Yes, now it works. So I'm trying to share the screen. I don't know. Is this visible?
Not yet. Now it's on the way.
There
Yeah.
you go.
Okay, great. So yes, how does Medicare for All work? I kind of feel like it's really good to go over that, just like Terry also mentioned, because in healthcare there's so many different things. It's complicated. So in a nutshell, there's a bill, the Medicare for All Act, and that bill, if it would be made a law, would make universal healthcare reality in the United States. So basically, here you can see on the screen that bill, the Medicare for All Act. It's in Congress right now again, of course, and yeah, you see a picture from back in May of last year when it was introduced again in Washington, D.C. at the Capitol. And this is a bill that would make Medicare for All reality. And how would it work? So basically, you would receive a card. So instead of having these cards that we have right now, no matter if we have, private insurance card or like a Medicare card, but then we also need like an extra card for dental and an extra card for prescription drugs or whatever it might be, we would just have one card. We would have one card of the improved Medicare program, and that card would also be good forever. So it's not like today where, I have health insurance today with my current employer, and then next year I might have a different employer and I need to get different health insurance. Wouldn't be like that at all. So you have this one card, and everybody can basically stay with Medicare from birth or like whenever they start in the program for the rest of their lives. And this is also an improved version of the current traditional Medicare program. It's not the Medicare Advantage quote unquote plans by the commercial health insurance companies. And how would Medicare for All work? It would actually be different compared to today's Medicare in that it would cover all medically adequate care. So that includes dental, vision, medical equipment such as hearing aids, mental health, reproductive care, including abortion services, gender affirming care, long-term services and supports, including home and community-based settings, prescription drugs, and more. And all of that also without any co-pays, without any deductibles, and without any other out-of-pocket costs. And in addition, there would be no narrow networks like we have it often today with commercial health insurance or the so quote unquote advantage plans, or also like none of these barriers to care like that we have today. For example, prior authorizations that you need health care, but you might not be able to get it or not able to get it very soon because first you have to jump through the hoops of prior authorizations. So at least kind of from just a regular patient perspective, from like a regular person, I feel like this is trying to sum it up how it would work. Like, other countries have done it. Like, say, for example, our neighbors to the north in Canada, they used to have no Medicare, and now everybody in that country is basically on a program called Medicare. And so they made the switch that everybody got a Medicare card and it covers virtually everything. And so we in the United States could do the same.
That's excellent. And one thing that I think it's important to add also there is the difference that we all see between our system where you switch a provider, and then they want to do the EKGs again, they want to do the labs again, they want to do all of this, and that is just added cost. But if you compare that with Germany, with France, with all these countries, you have the same card that you take to wherever you are, and that card it has that little chip, and it has all of your information. You take the same card to the pharmacy, and your medications are provided to you because your orders are in the card, and that saves so much money and hassle, right? So excellent. Thank you, Stefan. I am sharing also in the chat if anybody was interested in that jar of jelly beans explanation. The actual video is in the chat if you want to see it. Okay, next question. And by the way, feel free to jump in if anybody wants to chime in on anything that we're discussing. We have the time. This section is supposed to be 40 minutes, close to 40 minutes. Anyway, next question is on the political aspect, and it's Medicare for All has a broad public support. Why hasn't it passed, and who benefits from the current system?
Can I start taking that one?
Oliver? Yeah.
So I think, on the broadest level, we have a political system that is deeply unrepresentative of what the majority of people want. And you can look at that in so many different aspects. Here in Florida, we have things like an unconstitutional 60% ballot referendum threshold where we need to not just get 50% plus one, we need more than that by 10% to get basic things. That's why in 2024, when we had 57% of Floridians vote for abortion rights, that was not enough. 42 beats 57 because of these really relics of our slaveholding past, where we have a 60 vote threshold in the Senate. that we need the filibuster abolished in order to overcome. So there are these larger structures, but when you look at healthcare specifically, the largest lobbyer of the United States Congress is the pharmaceutical industry. They spend hundreds of millions of dollars to lobby members of Congress against the best wishes of the American people, which is to guarantee healthcare as a right. Medicare for all has overwhelming popularity among all segments of the American population, regardless of your partisan identification or whether you identify as a partisan at all. Most people believe that healthcare should be a human right, but we have these entrenched corporate interests that spend in the healthcare space more than virtually any other industry to prevent us from enacting this more cost-effective Medicare for all system that Stefan just described and that Carolina has described with the jar metaphor. We know that this would save a tremendous amount of money, but within that, there is a tremendous profit motive of the for-profit health insurance, the for-profit medical technology, the for-profit hospital corporations, and big pharma to keep the system as it is. And who ultimately benefits from that? It is the CEOs that are making egregious 20, 30, $40 million salaries. It is the corporate shareholders, and it is, in many respects, the members of Congress and elected leaders in state legislatures who receive donations from the corporate PACs of these for-profit entities that lobby members of Congress to vote against the best interests of their constituents. So this is very much intertwined with the corrupt system of money in politics that has been made even worse by Citizens United. So if we are going to pass Medicare for all, we also need to take a very hard look at overturning Citizens United and enacting public funding of elections, and also very fundamental and basic democratic reforms to make our system more responsive and not having so many pitfalls of minoritarian rule as we do today.
Wow, that was a lot. Thank you. So true. Okay, let's move on to the next question is, what does support or refusal to support Medicare for all tell us about leadership? And I guess, Terry, that's for you.
I'm sorry, can you repeat that, please?
Yes. What does support or refusal to support Medicare for all tell us about leadership?
Well, refusing to support definitely tells us negative things about, that if a candidate or a elected official doesn't support it, it shows that they really don't support the vast majority of people in the United States, and that the pharmaceutical companies and the other healthcare lobbyists are more important to them than the people. If they sign on and they support it, at least they've done that. I'll just say that. But I will also say that I've been very disappointed in many who actually have signed on, and then it seems like that's all they do. Like they don't do anything to try to popularize the idea and educate people and answer misconceptions and educate their colleagues. It seems like, I mean, maybe they're doing things behind the scenes, but they don't really do much publicly. And it really bothered me that in 2020, in 2021, after we had, Biden in the White House, and we had the Democrat majority in the House and the Senate, and we had COVID, we had a pandemic going on, and yet we couldn't get even like a really big push for Medicare for all, and even now, I don't really understand. I mean, people are losing and have lost their subsidies, good portion of their subsidies. And like you have on the one hand, you have Trump saying, oh, well, we'll take it away from the insurance companies and give it to the people. And it just seems like a perfect opportunity that Democratic leadership who really supports Medicare for all should, on the one hand, say, well, yeah, he's right in saying take it away from the insurance companies, but the way we need to give it to the people is to give it to the people's healthcare system. You know, a Medicare that's really a public thing, not to make private profit, and it's run by the people, of the people, by the people, and for the people. And that's how the people should get the money. And then it goes to the actual providers, which are the doctors, the nurses, the other healthcare workers and facilities, etc., not the insurance companies. But I don't hear that being raised in a big way. Maybe it isn't because there's so much other crazy stuff going on. We don't hear it. I don't know, but I would like to know what people think about that, and why, even those who have signed on to Medicare for all, even those who've introduced it, it's like they do it and then it seems like they drop it. It's not like a constant thing, and they don't take advantage of situations that present themselves to really educate and publicize around it.
Excellent. Or use it as a chip, right? And it's so obvious. An example of that is Jared Moskowitz, right? The incumbent that is being challenged by Oliver Larkin. Mm-hmm. And he promised when he was campaigning the first time that he was going to sign on the Medicare for All bill. And he just did a few weeks ago because he's running again and because he's being challenged. So we as an electorate need to be very aware of politicians doing politics and doing nothing else but politics. And that is a prime example of that. He had the opportunity of supporting and doing actual work for that in a community that was very active and that knows about Medicare for All, and that has done a lot of work for Medicare for All. I saw Maria in the meeting. She was part of the meetings where we were pushing the congressman that was serving prior to Jared Moskowitz, and we were able to get him on board. And he was not just on board, right, Maria? He was actively in meetings and doing some teaching, and like he actually became an activist for Medicare for All. That's what we want to see. That's what we want to see. Somebody that does things because they believe that is for the good of the people, and not just because they want to earn the vote and then forget about us, right? Okay, we are done with the questions that we prepared. I don't know if anybody has anything else to add on our speaker side. And if not, we can open it to the participants and see if there's some questions. I don't see any in the chat, but if you have questions, not statements, please feel free to unmute and ask your question. And you can ask it to everyone, or you can address it to a particular speaker. You guys are shy. Why don't we talk a little bit more about what you were talking about at the beginning, Terry, and on how we can help here in Florida to reactivate or to amp the fight for Medicare for All and all these other things that are related. So there's bills that are related, and I know that you track legislation just like I do. Mm-hmm. for the bills that can help us get to something at least closer to universal health.
Right. Well, we do have the organization Medicare for All Florida, and besides working for a national bill and promoting that, we do also work for getting good bills introduced into the Florida legislature. So, for instance, we have the $35 insulin cap copay for insulin. House Bill 367 by Representative Harris and Woodson, which again, the organization Medicare for All Florida, and primarily through a lot of efforts of Stefan, were able to get that introduced. And even, I think it's even Mississippi that has already passed that. So, I mean, if a state like Mississippi can pass it, we should be able to get that passed. And then there's Carlos Guillermo Smith. Senator Smith has introduced a task force to study universal health care and the economic implications of it, et cetera, which we know that any time it really has been studied, it's saved money. And so, for instance, like if a state-based, there would be a state-based single payer system, it would end up saving the state a lot of money too, because right now, a lot of the workers, the state workers, and the county and local employees too that are government workers, a lot of money is spent in the police and firefighters, et cetera. A lot is spent on healthcare, and a lot of that ends up going into the insurance company's pocket, not to necessarily to the actual providers of the healthcare. And so also the Healthy Florida Act is Senate Bill 740 and House Bill 1489. And those, again, would provide universal health care and also prevent medical debt. It would alleviate medical debt. So those are some of the things that we are working on within the state of Florida until we get a full national bill passed. And it has been noted that in some places where there is a national healthcare system, like in Canada, it started with one province and then another one, and then it kind of snowballed. So it's possible that something like that could happen in the United States too. So we try to work both ends of that.
Thank you, Terry. Stefan, is there anything that you want to add on the national level, or can we move on to the next question?
We can move on.
Thank you. Next question, Gloria, if you can unmute.
Good evening. How are you all? Thank you so much for this great forum. I wanted to get some perspective as we think about the process of transitioning potentially from the Affordable Care Act and our current system that's a little bit dysfunctional. How do you envision that transition? Like, has there been a framework established that would help, if you will, address some of the leeriness that people naturally feel when there's change? And it would be a very big change.
Stefan, do you want to take that one?
Sure. Yeah, of course, as you mentioned, dysfunctional means the current healthcare system, more than 30 million US residents and like more than 2 million Floridians don't have any health insurance at all. So yes, it's very dysfunctional. And for the transition, there's actually also in that bill that I mentioned earlier, the National Medicare for All bill, there's provisions in there. So basically what it would envision doing is take like the age to be eligible for Medicare down So in the first step, basically, the bill would improve the current Medicare program to do all these improvements that I mentioned earlier. Um, and then also it would, for example, take down the age from 65 to 55. And so that way kind of gradually um, lowering the age like until everybody eventually is covered. So it's kind of like year after year, like more and more people are covered. And also I think right away there's also like a buy-in plan available as well. So if basically the age is starting to be lowered, but you are not part of that group yet that is able to enroll by age, then you can buy in. So that's basically the transition period that's outlined in the bill.
Yeah, there's a rollout already established, and it includes also recommendations by physicians. So if you have a disease and you're still not in that age group, your physician can recommend that you're part of that, that you're being taken care of, right, earlier than what you should. There's another question for Stefan in the chat, and that one's from our friend Zach. Do you want to unmute Zach?
Yeah, I actually didn't really have a lot of that come up yet. So I don't know. I mean, Oliver, you were also kind of working in the union field a lot. Did you ever come across that unions had like concerns?
Um, yeah, it definitely, I think, unions make concessions at the bargaining table, and healthcare is obviously an enormous issue for collective bargaining. So I believe, one thing that we emphasize is that this gives, with Medicare for all, this gives unions more bargaining power at the
Mhm.
negotiating table. If you have Medicare for all guaranteed, this gives you more opportunity to bargain for higher wages, other forms of benefits for pensions, retirement, other forms of support because you're not negotiating over your health care. So I would actually be very interested in reading into HR 3069 a little bit more to see in this phase-in period if that could also be lined up so that phase-in that lowers it from 65 to 55 and from 55 to 45. And at the same time, there's tremendous need to um, while there's a lot of bureaucracy in the private insurance marketplace, there would need to be a more robust healthcare administration within Medicare. So there would need to be time provision to staff up and be able to absorb all of these new people into a Medicare for all system. And so I think our point of emphasis with unions is that while there might be some timing with regarding when their contracts are currently set to expire and how that relates with potential passing of Medicare for all, that it would all be covered in that transition period so that when unions have their contracts up for renegotiation, that this is an additive measure to give unions and working people more power, not something that is undermining their CBA. So I think that's a really important thing to emphasize. Um,
Yeah. There's also the thing is that this is probably not going to be the most popular comment, by the way, so disclosure. But not all unions are the same. There's some unions that want to play it safe. They have the number of members that they have. They don't want to lose anyone, and they use that healthcare as an attractive measure so that workers join the union or stay in the union. And there's a lot of unions. The majority of unions are in the good side of history because they already support Medicare for all. The majority of large federations are actually signers of the Medicare for all in some capacity. Okay, I actually just found out that, for example, SEIU, where I work, is supportive of the Medicare for all, but they haven't done an actual signing. They do teachings, they do support of events like this one tonight. I didn't know it with enough time to make them accountable for that so that they would support this forum. But I did check, and they actually support it, and they like having events like this so that they say this is what we're for, this is what we want. The fact that we are not regularly talking about it is because it's still not in the realm of reach, but and there's other fights obviously that we need to have. And also talking about bargaining contracts, it's a lot of times I bargain contracts. That's why I feel that I should chime in. Is that many many times what we are doing when it comes to healthcare and healthcare reach for our workers, we offer what we can offer, right? It's not that we are not supportive of Medicare for all. What we want is Medicare for all, and we understand that if we take that out of the table, then we are less beholden to the employer and able to get more things for the workers. And those of us who believe that we shouldn't just bargain for the workers, but for the entire common good, then we are going to be able to gain more things at that negotiation and have more victories that are more significative than just healthcare, right? Nelson, you were next on the stack.
Yes, hi. I wanted to ask, is part of Medicare for All, does it incorporate, for example, people who have accidents in their job? Usually when somebody has an accident in their job and they have to go through workers' compensation, or if you have an accident, a car accident, you have to go through your car insurance. Does Medicare for All would cover those services as well?
Somebody wants to take that one?
Yes, I would. Yes, no other country does things like that, like we do with car insurance and accidents. If no matter where it happens, on whether it's on the job, at your house, car accident, or whatever, what's important is that people get the care that they need, and any sane healthcare system, that's the way it works. And it would under Medicare for All too. It would be it. I mean, it's possible that the Medicare system may then decide if they think somebody was at fault for something that happened. Who knows? At that point, just like our other government agencies might sue somebody, but it wouldn't be up to the person to have to worry about whether they're going to be covered or not. That would be something the financial people that are running the Medicare system would figure out. Would it make sense to, if a corporate, if there was a corporation involved that caused the problems that you had or something, then they may want to sue to recover some of expenditure that they had to put forth to see if it's worth it. But it wouldn't be something that the individual person who's was involved in the accident and is harmed has to worry about.
Yeah. And actually you would be taken care of, and then whatever happens would happen later. You would be taken care of. And then the other thing that we might want to add there is that it's going to lower the cost of your insurance at your home, at your car, because everything that is healthcare related is going to be taken care of by the Medicare for All, right? So the cost of whatever else the insurance for your house or car would cover, it's different. The next one on the stack was Dr. Flor. How are you, my friend?
Okay, thank you. CPS is ending, and I know many CPS recipients are healthcare workers and also human advocates. Then any advocacy initiative for those healthcare workers who are TPS recipients?
So I can take that one. You're probably aware that there's a lawsuit going on, and that the TPS expires at the beginning of February, and until the lawsuit is not done, we are encouraging facilities not to terminate workers that are still on that gap, because legally they are still unionized workers and they're still on a worker's permit. So whether it expires later or whatever, they cannot hire other people. They cannot remove them of the schedule, because then that's a violation of the contract, and unions are pushing back against that. So right now it's a waiting situation, unfortunately, but we're doing everything that we can, and most unions I know, and Stefan, you can probably chime in on this one because you're with the AFL, which is larger than we are. But what we are doing is providing information to people that are in the affected group, so that if they are able to apply to asylum or to any other possible legal status, that they have the chances of doing that before the expiration of the current TPS. So, Stefan, do you want to chime in anything else?
No, I think you really covered it. I mean, you're directly kind of representing those workers, so.
Okay.
No, that's important. That's very good, guys.
Thank you. Okay, the next one is Gabe, and then after him, it's you, Ed. So, Gabe, go ahead.
Mute.
Gabe, you're muted.
Oh, I'm sorry, I was muted. How about like with expensive procedures that are new that they can't give to everybody, and or procedures only done by a certain few doctors? Would that be like something that would be covered by private insurance, or what would happen?
If your doctor thinks that you need it, you will get it. That's it.
Okay.
Is there anybody else that wants to chime in anything else? No? Okay. Next one is Ed.
Okay, this sounds like a wrong question, but it's said lovingly, and it goes back to that word transition that you talked about before. From my vantage point out in the bleachers, I see three groups that you're not working with, and you need to be change their heart. And one is the doctors. The second is the employees of the insurance companies that are benefiting, and a third of the legislators. If you talk to any doctors and mention the word Medicare, do a survey. I'm sure you've done it, and they all badmouth it. So you've got to work with them. Secondly, the transition. There are hundreds of thousands of people in the insurance companies that are getting sweetheart salaries. Most of them are white, but a lot of entry level people in there that are making a good salary are blacks and Spanish in there. They're all going to be out on the street, more so than Musk. And the third of the legislators that are against, listen to them on TV anytime. Every one of them says, well, anyone will tell you Medicare is a faulty system. You and I know that the Democrats were backed into it because they couldn't pass it originally, and they had to give this opening to the insurance companies to work it through insurance companies, and that somehow you've got to address those, especially with the doctors. They're like termites. They're working against your program all the time. You've got to change them, and maybe the smallest compromise might be say, well, we're talking about health care for all, and not the trigger word.
Yeah, I think that we've talked about that in previous meetings. Yes, it causes a little bit of that misconception, but this is not a bill that was written. First of all, a lot of people don't know this, but this bill was not written by Bernie Sanders, right? It was written a long time ago, right? And so the reason that we're not now changing it or adapting the name for later is because there's a lot of studies, a lot of infrastructure already that is connected to the bill, to the rollout, like Stefan was saying earlier. There's a lot of work that has already been built around that, and now the name stuck, right? So even though we agree, just having the word Medicare, this does not really work like Medicare. But having the word Medicare has sometimes a little bit of a negative connotation, particularly now with this BS thing about Medicare Advantage, right? The disadvantage thing. uh, but that's where our work starts as activists, as members of the community that are more involved with this information. We need to teach our community, right? And that's also where people like Oliver comes to play a very important role, because you're now campaigning, right? And healthcare is an important part of your platform. So when talking to the people that you're campaigning to, there's an opportunity of educating and assessing also the need and the power of your support to the Medicare for All bill, and how is it going to impact your constituents' lives when you support it.
Yeah,
Right?
and I would love to actually jump in here on the
Go ahead.
subject of the opposition in the medical field to Medicare for All, because I think this cuts to the heart of a much deeper truth that Medicare for All and single payer health insurance is but one piece of a larger healthcare justice fight. And I think another large piece of it is the inaccessibility of getting a medical education in the United States. And I think that groups like the doctors associations, the American Medical Association, there is an incentive structure to keep medical school acceptances low so that you can justify the high salaries. You have a bottleneck of people who want to become doctors, want to become physicians, want to become healthcare providers, but either they do not have a family that can cover the cost of a medical education, or they cannot afford to take on the hundreds of thousands of dollars in debt that is then becomes the precursor to the extravagant salaries that many medical professionals are able to earn. On the other end, you've got the physicians who want to serve underserved communities and communities without much access to health insurance, and it becomes very hard to make a living serving those underserved communities. So there's a gravitational pull towards the high income, high salary fields. At the same time, with state legislatures and particularly after the Dobbs decision in 2022, there was already a severe lack of abortion providers. Most abortion providers are becoming they're growing older, they're aging into retirement. And with the laws in place that make it illegal in many cases to provide abortion care, medical schools are not teaching this essential form of healthcare. So I think we need to also have the conversation about making college for all free and not just undergraduate education and technical and vocational schools and community college, but increasingly getting a medical education as well, because we have such a deficit of doctors, and the
Mhm.
ones that we do have are insulating themselves because of the pre-existing structures, and it becomes a class issue as well. We should have more medical providers. I don't want to belabor the point and go on too long, but on the point of the healthcare administrators in the private health insurance field, there is a real need that is going to be there to increase the capacity for the Medicare program to be able to service people. And so making sure that those jobs are good paying union federal government jobs has to be another key component of our healthcare justice fight.
Absolutely. Before we move on to the next three questions that we have, the next three hands over there, I wanted to make sure that everybody sees on the chat. There's a flyer that for some reason somebody made a mistake with the day. It's tomorrow, Wednesday. The date is correct. And it's going to be at the Fort Lauderdale Airport. We would love to see you there supporting all the Haitian community and everybody that's impacted by the TPS ending. It's going to be a very nice event, and we're going to have a lot of press also over there. Okay, the next one is David Perry. Thank you for being here. It's so good to see you, my friend.
Yes, hello. It's really good to see you. I've interacted with you, I guess, for maybe a couple of years now, so it's really good to see you on Zoom. I just want to just say real briefly a little bit about my background. I was a lawyer in the U.S. Department of Health and Human Services in the Office of General Counsel, and my client at that time was known as the Healthcare Financing Administration. They've now changed their name to CMS, to the Centers for Medicare and Medicaid Services. And I basically traveled the nation defending the Medicare program against lawsuits, and also drafted many Medicaid regulations. So a little bit of a background in healthcare law and healthcare regulatory law. Bottom line here is it's all about money. Okay. This idea that Obama was somehow powerless, that Clinton was somehow powerless to come up with this Byzantine framework for healthcare is all, and excuse my technical term here, bullshit. Okay. They can enact Medicare for all tomorrow. All right. But the problem is, and I really saw this when I was drafting regs for the Medicaid program, there are such powerful forces, bipartisan. Okay. It's not just Republicans, it's Democrats. That's the problem. Bipartisan neoliberal forces that are making huge amounts of money off of the suffering, the pain, and the sickness of people.
That's right.
Where healthcare is a commodity, where if you're poor, you get sick and die. And people are making money off of that, off of other people's pain and suffering. Tremendous amounts of money. Healthcare is, I believe, the largest non-military sector of the economy, the biggest. If you go into any community, they're the largest employer. The number one largest employer is healthcare. This is huge amounts of money. And so that's why this system is not going to change anytime soon, even by the most progressive of candidates, unless we do some very systemic reform to capitalism itself, because they simply will be overwhelmed. Okay. So the best we can hope for is Medicaid expansion. I think Medicare for all is just ain't going to happen without some very serious capitalist systemic reform. But the best we can hope for is a Medicaid expansion, which is just a Band-Aid on a hemorrhage. That's all it is.
Excellent. Before we move on to you,
want to
Nelson.
just make sure that we just put to rest this belief that somehow presidents are incapable of enacting Medicare. That's BS. Okay. And Trump has demonstrated the power of the presidency.
Yeah. Unfortunately, on the negative way, right?
In a very negative way.
Yeah. Thank you, David. Before we move on to you, Nelson, I wanted to share something because we've been coming back to this TPS situation. I think that it's very important for us to know a little bit of statistics. So if you allow me to share this, 30.4% of all healthcare workers are immigrants. From the nurses side, just on the nursing side, 29.1% of nurses in Florida are immigrants. On the home healthcare aides, that reaches to close to 60%. And then if we're talking about personal aides, that's 40%. And if we're talking about CNAs, which are the vast majority of nursing aides in all healthcare facilities, but more importantly on nursing homes, we're talking about 45.4%. So imagine what's going to happen once and the majority of them, by the way, are from Haiti. And so imagine, and I'm going to leave that question just lingering, imagine what's going to happen to the healthcare system in Florida if we lose them. What's going to happen to your grandparents, to your family members. So just leaving that there. Nelson, you're up, and then Lorenzo. And I think with Lorenzo, we're going to close.
Yeah, as part of this push for Medicare for all, I think it should go in a way in hand with taxing the rich. And not necessarily also the rich, some people who are high earners, for example, Medicare, payroll taxes. As soon as you reach $200,000, you as an employee would have to pay 0.9% more in taxes, and your employer doesn't have to pay more in taxes if you are paid $200,000. So if you make $200,000 from that point on, as an employee, you pay 2.35%, and your employer pays 1.45%. So I think it's also important to tie the cost and show that we can actually, tax and pay for the program, which I think it's a little bit overblown, the cost, because if we, reduce prices, instead of an EKG costing $250 and costing cents, or a venipuncture instead of costing $20, when it costs less than, it's just, a simple procedure, there's going to be cost savings there. So we also have to be a little bit more critical, look really into the numbers, kind of state how much each procedure would cost, have a database where we say, hey, these are the prices we think are adequate to be paying, and then we can reach an estimate as to how much it will cost, and then put it hand in hand with, we can tax these incomes, we can tax, the rich, or whatever the case may be.
Excellent. Lorenzo?
Yes. Before we conclude tonight, let me say that this has been a tremendous forum in terms of content. One of the things that I want to leave with is that following what David Peary said, which to me is totally correct, we are living on a system that it's not going to be accessible. Medicare for all is not going to be accessible unless we change the mindset that is in the country, and that is able to. We have Ed Cook mentioned the doctors, mentioned the workers, and mentioned the politicians. All of them are being corrupted by this financial system, and all of them have to be changed in terms of the mindset in order for us to be able to move forward on this deal. So and I hope that we continue this discussion, because obviously this is a discussion that not only deals with healthcare, but it deals with the whole system as a whole, because everybody needs health care. There's nobody that is out of the deal. Everybody needs health care. So the vast majority of the people can be in our side in this issue, and this issue is an issue that links all the other issues. Thank you.
Excellent. Thank you so much. I am going to open the mic a little bit for our speakers. If you have anything that you want to plug or a call to action, please take no longer than 2 minutes, but share with us what you want to plug. Who wants to go first? Terry, do you want to go first? We were talking about it earlier. I'm going to start with speakers, and then after the meeting, we can stay longer for anybody else that wants to do plugs after we do the closing. Speak, Terry.
Oh, okay.
Mhm.
It's somewhat related, but not totally. People need to know about in the Florida legislature, there are 4 very dangerous bills, interrelated bills that would threaten to criminalize, really secretly criminalize any advocacy group, basically. Um, it would give the power to DeSantis's appointed FDLE head, the head of Florida Department of Law Enforcement, to just like unilaterally decide who he or what group he wants to claim are terrorist organizations.
So scary.
And then just between him, the governor, and the governor has 3 cabinet members, right? So the attorney general, the agriculture secretary, and the CFO, and 2 of those, and the governor and the Mark Glass, who's the head of FDLE, would be able just among themselves to label an organization as terrorist, and with all the implications that could have. And then it would have felony charges for people that would promote the organization in any way, or stand up for them or whatever. And then and it would be not subject to public records, like to find out even why the organization was declared to be that it would not be, they wouldn't have to release any public records, or even to the legislature themselves. So we're hoping that the legislators will not support this, because they're like basically giving up their right to know anything about, and it's just like, trust these 4 people to just make this decision. So the first hearing on 2 of the bills, the 2 House bills, is going to be Thursday morning at 8, and they just put that on the schedule today, which is unusual because up until recently, they've always, like, the Thursday before, they make the plan for the committees and what's on the agenda for the whole next week. And like Thursday and Friday, it wasn't on at all for this week. And then all of a sudden today, it's on for 8 o'clock in the morning on Thursday. So
name a number of
it's the civil justice subcommittee, meaning civil justice and claims subcommittee, and you can look that up. And it has 17 members. So just call as many of them as you can. That's what we're asking people to do tomorrow, to spend.
And that's on the Florida House, right?
Yes, the Florida House Civil Justice and Claims Subcommittee. If you can call them.
That's
Thank you.
myfloridahouse.gov.
The bill
And
number.
I'll put the bill numbers in here, that just the House bills, and then they have companion Senate bills, but they're not. So far, we haven't seen them scheduled yet. But
excellent, thank you, Terry. And let's jump on to Oliver. Do you want to do a plug?
Yeah. Well, first off, I want to plug Medicare for All Florida, this wonderful organization whose t-shirt I'm wearing right now for this call. Stefan mentioned it, or perhaps someone else mentioned it, but this wonderful Medicare for All forum, a conference that we attended at the Space Coast Health Foundation in Rockledge last fall. I just cannot say enough about what Medicare for All Florida has done to bring people together from all different parts of our state. And I really think that in this moment where there's such rank partisanship, that Medicare for All, this idea that healthcare is a human right that we can extend to our political foes and have that expression of love and solidarity for our shared humanity is so important right now. We did not get into the subject of medical debt all that deeply, but this is Medicare for All. What we're talking about is hope for people of a different kind of life, of a better life when it can feel so overwhelming and you're just staring up from the abyss of hundreds of thousands of dollars in debt. This is really, I think, a hopeful and optimistic and joyful fight that we need to be having in a moment where, with the expiration of the ACA premium tax credits, with $1 trillion or more cut from Medicaid, people are going to be suffering, and they will suffer more in the coming weeks and months and years until we get this right, until we get this done. So this is a cause that its importance is only continuing to grow. And with that, I have often thought that there was never a time like a once in a century pandemic to fight for Medicare for all, but the next best time to win it is right now. So I'm very honored to be here in solidarity with all of you and fighting the good fight for Medicare for all. It's so important. I'm also going to drop, I know I didn't speak much about the campaign and don't want to devote any time to that, but I will drop the link in there for people who want to follow us along for our campaign and our race. Thank you again for putting this together. This was an extraordinary event, and I hope we can do them more often.
Thank you. An awesome campaign, by the way. And I really encourage everyone to go look at the platform, share it with friends. Even if you're not in the district, please share it with your friends and get them connected. And if you can volunteer and donate, that's going to make a huge impact. Because remember, Congress people don't just serve or obstruct work for their district. He is running against one of the most toxic Congress people in the country, right? In the Democratic side, I should say, but he's one of the worst. And it's very important that we support voices like Oliver's that come from us, that share our values, and that are going to fight for us, for what we believe in. Stefan, it's your turn.
Yes, thank you so much, everyone. And yeah, can echo some of this. So happy to see Oliver run. I actually do live in this district. So yeah, and I did have this opportunity, I think, a few times to, just as a volunteer in my free time to help door knock, and definitely plan to do it again. But yeah, on the issue of healthcare, I just was going to say, make no mistake, it was how bleak everything might be looking. There's actually at the same time also momentum. So we have seen in December how there were like 7 federal legislators who, over the span of a month, kind of signed on to the Medicare for All bill who were not co-sponsors before. There's recent polling, like which was already mentioned, like showing that vast majority across all political stripes support Medicare for All. There's actually, just like we are like having these conversations here in Florida, there's people just like us who care about healthcare in other states, and they are like doing activism for healthcare. And there's already Oregon that has a universal healthcare governance board and is in the process of figuring out all the details to make it so that in a few years Oregon might have universal healthcare, and lots of other states are doing stuff too. And so there's actually like a lot of momentum that often we might not be aware of. And so I just want to put that out there. Thank you so much, everyone, for having an interest in this and for all you do, because it is definitely, healthcare, at least to me, is worth the fight. And thank you so much for mentioning the event tomorrow for TPS Solidarity. I'm going to try to be at Fort Lauderdale Airport. And also wanted to mention our union brothers and sisters with the National Nurses United. Of course, they are fighting for Medicare for All, and they actually have tomorrow evening at 8 p.m. their national Medicare for All strategy call. So I'm just going to drop that link here in the chat for anybody who might be interested. Thank you so much.
That's awesome. Thank you so much. And you see, Maria is right there. She's also with the National Nurses Union. Okay, let's close. And I want to leave us with this. Medicare for all is not radical. What it is radical is continuing a system that forces people to suffer, to beg, to die in the richest country in Earth. Support Medicare for all is one of the clearest litmus tests that we have. If you have a candidate or an elected official that supports Medicare for all, that tells you that they know what the people want and that they support what the people want. Because it is one that has that high support among Democrats, Republicans, Independents. Everybody wants and needs healthcare access. After tonight, you will receive links to Medicare for All resolutions that are going to teach you a few things that you can do to help support your community to support Medicare for All bill. Trusted educational resources that you can share with your family and friends. There's also going to be some tools that are going to be so that you are able to contact your elected officials to talk about this. And the call to action is simple. Demand that every elected official publicly state that they support Medicare for all. Healthcare is a human right, and rights exist so that we can enforce them. Thank you for being here. And thank you for engaging seriously on this fight and for refusing to take less than we all deserve. Have a good night.
And we leave with Nelson. I said, oh, Nelson, no.
Yeah, I wanted to just, in closing,
Go ahead.
if anybody needs free healthcare and lives in Liberty City or anywhere in Miami, Dade County Street Response, the work Armin Henderson is doing is very valuable. So if again, if you know anybody that needs free healthcare, Armin, you can go to Dade County Street Response, where Armin can take care of you.
Thank you so much. Anybody else has anything to plug?
Corpus Christi Catholic Church has a clinic for all immigrants without any coverage on Northwest 7th Avenue and about 31st Street. Yeah.
Thank you so much. Glenda?
This was amazing. I turned my light off. This was amazing. You guys were awesome. All the speakers, all the information given. I'm speechless. It was great. Thank you so much. So awesome.
Thank you all. Really happy to be part of this. And thank you for our speakers. Thank you for being here. And thank you to all the participants. See you soon.
Good night. Bye-bye.
Good night.
Give yourself a pat on the back. Essential workers.
Awesome. Have a good night.